It's so important to have more physicians in the community. Part of that is having a general surgeon and having a full-time general surgeon here. Dr. Sorensen happened to be looking for, I'll let him talk about that, looking at the same time that we were looking to add to the community complement of physicians, and so it's worked out quite well. So this is a real coup for Desert View Hospital and Pahrump to be able to attract such a world-class surgeon.
I come from Salt Lake City, and as Kelly said, about the time he was looking for a surgeon, I began to look for a smaller town than Salt Lake to work in and connect with the community and just take care of people. And I think I found it here. This is a lot of fun. I'm looking forward to it.
What does this mean for the services that are going to be offered on site there at Desert View Hospital?
Yeah, this expands the cadre of surgical services. As I look at the transfer logs and transfer records of patients leaving and out migrating to Las Vegas, this will kind of decrease that. So we'll be able to take on the general surgery cases, others that we can keep here, some of the more critical patients.
Let's hear about your professional career.
Well, I've been in practice for a little over 20 years. I've been trained in general surgery and also in transplantation, critical care. I've done a lot of trauma surgery, cancer surgery, transplant surgery, and also been deployed 4 times with the military. I've got some experience that I can bring to the table, and I look forward to doing it here.
With the advanced training that the nurses are having in trauma, and of course Dr. Sorensen's trauma experience there, and the rural area that we're in, this is really going to help on some of the injuries, accidents that we have, and emergency situations that come about.
Yeah, you're right, and thank you for mentioning that. You know, this past year we've sent our nurses to critical care training. We've made some changes in leadership in a number of areas, and so all those things, if you will, are the development of improving the healthcare delivery system here in the Pahrump Valley.
Will you be taking patients regularly, or just on call as far as like situations where a surgery is scheduled?
Well, both.
As more physicians come, more primary care physicians join the community, more surgeons, more surgical services will be available, and all intermediate, immediate, and advanced care will take place at Desert View Hospital.
Wonderful. And you've already started there now?
I have. We've been up and running for about a month and a half.
Wonderful.
And it's going well. We're building, and so far so good.